Good morning, all. This is Dr. Sue from Purely Pediatrics. I am starting to make a series of videos and audios that will provide some information and care with regard to common pediatric medical issues. And this week, I'm going to start talking about rashes. Now, rashes are something that are so common in the pediatric world and in the adult world actually too. But the part of the rash issue I'd like to talk about this morning is called diaper dermatitis. It is something that can drive parents and pediatricians nuts. What it is first of all, I want to make a disclaimer that whenever you have a diaper rash with your little one, make sure you talk to your pediatrician about it. There can be different reasons for rashes and different medications that can be ordered. When these medications start to limit their helpfulness or their effectiveness with the rashes is when I start to consider diaper dermatitis. And what that means is that it's an inflammation of the diaper area and can be common in children that have sensitive skin. It can worsen with teething. It can worsen with growth spurts. And generally it can look almost like there's little wounds on the baby's bum or the child's bum. These wounds are what I call excoriation, and they're from inflammation with the skin becoming very thin and very apt to kind of be sloughed off when we clean. Keep in mind that diaper area is a tough one, and it's always dark, it's always wet and moist, and oftentimes we use wipes that may not be as ideal for wiping baby skin as we'd like. So the first thing I do with regard to my thoughts of diaper dermatitis is I always tell families to get a barrier paste, such as triple paste or butt paste, and make sure you apply it thickly on that diaper area with every diaper change. And when I say thick, I mean like frosting. If we create a barrier, we can often allow that skin to heal and keep it from becoming moist and wet from the urine and the stools. If this does not work, I will reassess the rash, and if it still looks like a stubborn dermatitis, I will even consider ordering a gentle steroid cream for that area to see if we can help that. Sometimes it does work, and it can be, remember, steroid creams are topical. They are very safe for eczema and rashes. We order the gentlest percentage of hydrocortisone that we can with regard to the diaper area, as that is absorbed by the skin pretty quickly. If this also does not help, or families don't want to opt for a steroid ointment or cream, what I have been telling families about, and I learned about from a dermatologist colleague of mine, are two wonderful barriers that are available online. One is called Cavalon Spray, and the other is called Ilex Paste. These are actually created for stomacytes, which are openings of the skin that may require feeding tubes and those kind of things. They are so helpful that we are finding for stubborn diaper dermatitis that it is a wonderful, both of them are wonderful products to use. Cavalon Spray is a thicker spray that you would use with every diaper change, and Ilex Paste is a paste that you would use with every diaper change. I have started using these with my families, and I always tell them they're both equally effective. I have some families that like the ease of the Cavalon Spray, and some families like the ability to put the paste on themselves and cover different areas with the paste. These are both available from Amazon and likely other sites as well. They can be a little pricey, especially the Ilex Paste. So with regard to that, I will tell families, go ahead, try the Cavalon Spray, which I believe is a little bit more affordable. You know, I don't want anybody to to spend too much money on a product that they're not even sure if it'll help. But in general, I want you to know that these products so far with our families at Purely Pediatrics dealing with diaper dermatitis have worked wonderful. So I want to make sure that you know about those products. They are available online. They're both very safe, create barrier protections, and moisturize at the same time. I'll have families that are just very concerned about these rashes. They are often not infected. If ever they do look infected again, please reach out to your pediatrician. Let them take a look. If they take pictures, send them some pictures. But the other item I wanted to mention to you is when your babies have severe diaper rash, try to stay away from wipes. Although we'd like to say that wipes are very gentle, and the baby product industry oftentimes uses that word. Oftentimes just using a wet washcloth and water is the safest way to cleanse the bottom of the baby. So make sure that you consider that if you're dealing with this diaper dermatitis. And it can be tough. It can be a really hard thing to deal with. Remember, teething makes those stools much more looser. It can change the pH of the stools. And, there's going to be times where you do deal with diaper rash. That is just one of those unfortunate things that with baby skin we can deal with. When this rash starts to become very stubborn, very irritated, that's when I'd love for you to talk to your doctor about a stronger barrier protection, such as Cavalon spray and Ilex paste. Super, super helpful products I wanted to make sure you knew about. I'm going to have another presentation on rashes, just more rashes than diaper dermatitis in general this week as well for you. But let me know in the comments if you have any questions. Remember, your pediatricians are always here for you. We practice medicine with children because we love them. We love our families. We love to help. So remember, no question is silly. Talk to your doctors, guys. They're there for you. Have a great day, everybody. Thanks so much for listening.